All right. Good afternoon, everybody. Happy Friday, and welcome to another episode of Go Beyond. My name is Alyssa Robinson, and I am the digital strategist here at Trietsch, and I am sitting here with Reverend Daniel Humbert, our senior pastor. And this week, we have been focusing on James chapter 4, and the theme was godliness versus worldliness. And one of the things that Daniel brought up in our Go Beyond conversation on Wednesday is a really great way to measure, are we living in accordance with God or are we living in accordance with the world, is by taking the spiritual health assessment that we have made available on the Trietsch website. It's at tmumc.org/health check. So I'm just going to ask Daniel to give us an overview of what this spiritual health assessment is, what we're measuring, and why we're doing this.
Yeah, that's great. Thank you for the opportunity. I'm very excited. This is something I've been sort of wanting to do for years, didn't really know how to do, if you will, because it is a difficult concept. And then about 6 months ago, Denise Robinson and I started working together and finding data and finding information and other outfits that kind of were doing this and seeing what they did that might be working and what might be helpful. But the assessment is basically a self-administered health checkup of our spirituality. So it's a self-assessment in that when you take it, you're just going to have to be as honest as you possibly can with regard to the questions that you're asked. I think there are 48 questions, and it's the design or the purpose is to say, golly, based on your experience with God, on what we have identified at Trietsch as the 7 spiritual growth markers, 7 spiritual practices that we believe are sort of like the core things that help us grow in a relationship with Jesus. And so you just kind of answer these questions and they begin to help you better understand where you are with regard to those 7 practices. There's actually an 8th component based on fruit of the Spirit, which is kind of the output, if you will, with regard to spirituality. So if I engage in Scripture, or if I pray to God, or if I serve other people, or if I'm in worship and some of the others, then it's believed that when I practice these things on somewhat of a regular basis, that they will help me become more spiritually mature, that they'll help me grow in my relationship with Jesus. And ultimately, not only is that our goal at Trietsch, but the reality is that's our goal as followers of Jesus. Our goal is to get closer to Him, to love Him more, to love other people more, and to do what God would desire of us. And so the assessment is basically a spiritual health checkup. It's a way to say, golly, where am I spiritually? And it's self-assessed. So it's, there's no sort of magic pill or magic dart so much as here's where I assess that I am. And then when we're done, we give you what we call prescriptions, which are some guiding principles that we believe could help you read Scripture better, or pray differently, or worship in different environments, or share your faith in some other suggested ways. And so the prescriptions are designed to kind of help guide you through a little bit of that. So that's what it's for. It's a spiritual health checkup.
Yeah, and I've got to be honest, the first time, because being a staff member, this was sent out to us in advance for us to give it a try before we roll it out to the congregation. And my first reaction was, no, I'm not doing that. Because, and I've already joked, this makes me a bad Methodist, but the idea of there being a process for me and paperwork for me to fill out to determine where is my relationship with God really made me I don't like process. I didn't want to like be fit into a box. And when it comes to my spirituality, I tend to rest more on the mystical side of spirituality than the methodical side of it. And so what I want to know is, how can this assessment possibly tell me about my relationship with God more than, I'm already in tune with my relationship with God?
Yeah, well, so quite literally for centuries, we have known that there are certain things that help us in our spiritual relationship with God. And even the mystics, like Teresa of Avila or Catherine of Siena, would agree that at least some of these 7, if not all of these 7, were critical to a relationship with God. That is to say, Just the way that I talk to God in prayer, the way I engage scripture somehow, some way, that they are helpful tools, helpful instruments. And so much like with physical health, we know that, golly, eating right, whatever that looks like, but we know fruits and vegetables and grains and some forms of protein are helpful, and exercising help us to be more physically fit. We know that there are certain practices spiritually that just help guide us in a relationship with Jesus. And so I would not say so much, clearly there's a process to this in that we kind of complete the assessment, but then it's the prescriptions that become kind of and they're just suggestions. The prescriptions are not going to be like, take 3 pills and call me in the morning. It's, here are some ways that we might read scripture, or here are ways that we might worship God, or here are ways that we might share our faith with others. In other words, they're general, and yet they are specific listings of things we could do. And if we're already doing some of those, great. If we've never tried some of the other suggestions, man, might I give that a try to sort of stretch myself or try to help me better understand a different way to be in relationship with God. I think that's what our goal is just help us to figure out these things that we know help people in their relationship.
Well, and that's with the whole, comparing it to a healthy diet thing. I think that that's something that's really good to clarify, is that oftentimes when I'm looking at a healthy diet, it feels overwhelming. It's like, yeah, I'm going to eat my fruits and vegetables, but I also want a piece of cake. And it just feels like with this assessment, it's putting a lot of pressure on yourself and feeling like, man, there's high expectations. And what if I don't meet those expectations, or I'm never going to be able to live into or live up to those prescriptions? What
Yeah.
would you say to that?
Well, what I would say is it's a journey, and there is no ultimate destination. There is no expectation is what I said, what you said, what the individual sets. And so the expectation is only what you're going to bring to the table yourself. And then in terms of how we live into that, there is no specific way to live into that other than to give it a try. And so just like when we go on a diet or an exercise regimen, we certainly want to set goals for ourselves, right? It doesn't do much good not to. But when we don't hit the goals, we don't beat ourselves up. At least we shouldn't. I mean, that's not helpful. We just say, golly, I'll try a little bit better tomorrow, or I need to give myself a cheat day, or, whatever language we give to that. All of those programs, whether for physical health or mental health or anything else, all have what I call built-in ways to help you not um, tax yourself so much that you don't ever want to do it again, that you don't ever want to sort of keep going. But there are goals, and there are ways for us to reach those goals. So again, any of these prescriptions are not going to be, this is the way you must do it, but rather this is a way to do it, and this is an opportunity for you to do it. That's the goal.
So what are the 7 spiritual markers that we're identifying? And you've mentioned that there are possibly more than 7. Which ones are we leaving out, and why?
Yeah, well, I couldn't even go into all the ones we're leaving out because there really are too many. But the 7 basic ones are engagement with Scripture, which we know statistically is the number one way to grow our faith. Just reading Scripture, prayer is another one. Service to other people in the name of God. Faith sharing, evangelism or sharing, telling the story. Community or relationship building, so small groups, so that we are challenging one another. Then generosity, of time, talent, and dollars, and then worship. And so those 7 are what we would just call the core 7. Other things that are not necessarily on there range anywhere from fasting, which we are tying to prayer, but fasting is a separate spiritual practice. Then there are many forms, other forms of prayer, solitude, for instance, secrecy, which is just doing things in the name of Christ, but not broadcasting it to everybody and telling everybody that I did this or that. Those are other forms, but golly, I've got several books of spiritual practices that probably list about 40 to 50 different kinds of spiritual practices. So we just say these 7 would be the real base element, that they are the critical catalyst to making that change happen.
So is the idea with the 7 markers that all of us should be doing all 7 every day? Or is it to pick some of them that help you feel the most connected to God and live into those.
Yeah, that's a great question. So certainly not to be doing all seven every single day, but to be engaged in all seven at some point on a regular basis. Like I don't know that we would be sharing our faith every single day, but on some form of a consistent basis. In other words, it's a part of our lives. I do hope that we would try at least to pray every day, to perhaps engage Scripture every day, even in a simple way like a verse or something that we see or post or whatever. And then, golly, what was the latter part of your question? Was not only should we be doing it every day, but
Could we pick one or two or three that help us feel more connected to God and just really put everything we've got into those?
yeah, yeah. So the way the assessment works is you kind of get a score, if you will, about where you are, and there are ranges. And what we recommend is that you focus on those spiritual markers that you've kind of got the lower score in. That those might be the areas you might want to give a little bit more attention to. For instance, on mine, it was no surprise to me at all that faith sharing was the lowest in terms of the score that I got. It's not something I do on a regular basis,
Isn't it
and
that
so
what you do for a living?
not really. I used to consider it that, but my spiritual gifts, for instance, are teaching and proclamation, and so I tend to lean on teaching rather than sort of faith sharing with somebody that doesn't have faith. So I do more faith sharing with people who already have faith than faith sharing with people who don't have faith. And so that's something I'm challenging myself to be a little more intentional about in my lifetime. And then the other thing that was surprising to me was I was just below sort of what we would call the upper range with regard to Bible engagement. So I was sort of in the middle range. And golly, I'm thinking to myself, you're a pastor, you read Scripture regularly, you teach this stuff, and yet that wasn't sort of in your high range. And what it indicated to me was, for my professional life, I do that on a regular basis. But for my personal own devotion, I'm probably lacking in that. And that's just something I need to work on. So the goal of this is not to beat up on ourselves or to say you have to reach some, milestone, but rather just work on these things. Work on them like you might work on a diet for your physical health or exercise for your physical health. Just work on it.
All right, that's all that we have time for. I guess I'll work on it. You can take the spiritual health assessment now at tmumc.org/health check. So I hope you'll go in and check that out, and we'll see you next week. Bye,
Absolutely.
everybody.
Bye-bye.